Hi, are you hypertensive? On top of that, do you have diabetes mellitus? Or is your waist size or the size of your jeans in males greater than 40 inches or in females greater than 35 inches? Or is your lipid profile levels bit elevated? We are talking about a condition called metabolic X syndrome. This is a bitter consequence of our improper way of living. It is a lifestyle disorder, and the term for that in Ayurveda is Santarpana janya rogas, and we'll deal with the Santarpana janya rogas in our next video, and for the current video we'll stick on to this topic of metabolic X syndrome. So how to diagnose metabolic X syndrome? 4 conditions, and they are abdominal obesity, and how to measure that? Waist size greater than 40 inches in males and greater than 35 inches in females qualifies for this. And second is hypertension, BP greater than 140/90 millimeters of mercury, or if on hypertensive drugs the value is bit reduced, it is greater than 130/85 millimeters of mercury. And fasting blood glucose, if it is greater than 100 milligrams per deciliter, that is the condition. And fourth one is triglyceride level greater than 150 milligrams per deciliter, and HDL, the good cholesterol that we need, if it is less than 40 milligrams per deciliter in males or less than 50 milligrams per deciliter in females, it qualifies for this metabolic X syndrome. So out of these 5, if one possesses at least 3 of them, we are in the category of metabolic X syndrome. So this is a typical condition that is solely occurring because of our improper way of living. So that means if we switch on to a proper way of living, we can get rid of this. And how? It's easy. Like for diabetes mellitus, a genetic predisposition is there. We are not denying that. But what is there in our hands, at least we can check that, like excessive intake of pastries and all baked items, that can be checked. Then excessive salt intake or intake of processed foods can be controlled. That is within our reach. That is, we are the ones who have to decide what we have to consume and what we shouldn't. So that is in our control. And then abdominal waste, we have lots of yoga techniques for that, and if we practice that, it's very easy to get rid of the abdominal fat. And then dyslipidemia, controlling the fat fried items, it also helps, it is also easy within our reach. And that means metabolic X syndrome is a syndrome that can be tackled very effectively, provided we have the will to do that, and we have the desire to do that, and we find to take the time to tackle the situation. Thank you.